Hello, I'm Martin Kaiser from the Institute of Cancer Research and the Royal Marsden Hospital in London. I'm speaking about potentially improved treatments for high-risk and ultra-high-risk myeloma today. As we know at the moment, we treat all of our newly diagnosed patients with the similar or same regimens. But unfortunately, about 20% of patients do experience an early relapse, even if in receipt of intensive treatment. So we have performed a study in the UK, the Optimum MUC9 study, in which we actually screened newly diagnosed patients or those with a suspected new diagnosis of myeloma for presence of high-risk and ultra-high-risk markers. This screening was done also in order to reduce bias in terms of identifying really all the patient population instead of just a subgroup of patients that might be deemed from the beginning to be eligible for a trial. Now, out of 470 patients, 72 patients screened, we identified 107 that were both willing to and fit to participate in a study for transplant-eligible patients in which we tested the dara-CVRD regimen as an induction therapy. As a quintuplet therapy, this offers the intensity that we thought might be adequate for this high-risk, ultra-high-risk population, but by the same time also offers deliverability that could reach as well slightly frailer or not as mobile patient populations by being an oral and subcutaneous formulation. We saw a response rate of 94% after the induction therapy, which was then followed by bortezomib augmented high-dose melphalan autologous stem cell transplant, after which we observed an overall response rate of 83%, with a CR rate of 22% after induction and a CR rate of 47% after transplant. We also measured MRD, which was 41% patients were MRD negative by 10 to the minus 5 after the induction therapy with dara-CVRD, and 64% of patients had reached MRD negativity after the augmented transplantation. We think that this regimen does offer very promising activity. Of course, for the follow-up of the study, in particular PFS, which is very important in this patient population, is ongoing at the moment. And as a special feature of the trial, we will compare this using Bayesian statistics with a near concurrent trial group that has been profiled for the same high-risk, ultra-high-risk features from the myeloma 11 trial as well.